family doctor, so I went to medical school, 3 years of residency to learn to take care of babies and adults and deliver babies. But I discovered in doing my job that there was a real need for an expert in breastfeeding too. And so I just started learning more about breastfeeding, taking extra classes, and then I got certified as a lactation consultant. And now I'm able to offer some breastfeeding medicine consults. Breastfeeding medicine is more like an emerging field. There is an academy of breastfeeding medicine for physicians who help women who have medical problems with breastfeeding. So I still continue to take care of all of my regular patients, but a half a day a week I set aside to talk with moms who are having trouble with breastfeeding that lactation consultants haven't been able to solve. When I see patients for a breastfeeding medicine consult, not only am I seeing the mom, but I'm also seeing the baby. The two of them work together. So I allow a whole hour for that consultation. And the first thing I do is a full history. I talk to the mom about puberty, did her breast develop? We talk about the pregnancy, the delivery, if she was induced, if she had a C-section, did she have a hemorrhage afterwards that could affect her milk supply? Then we talk about the baby. Did the baby have to go to the NICU? Did the baby have to be intubated? And so it might have an oral aversion. And then we examine mom and we examine baby. I want to know, is the baby gaining weight? Has the baby gained weight appropriately? Is the baby urinating and stooling appropriately? We look really closely at the baby's mouth because sometimes a restriction in the tongue or the lips can affect pain and latch too. So we go through all of that history, then we do an exam mom and baby, and then we develop a feeding plan for the mom and baby. And I give mom 5 or 6 steps of what we're going to do, and then we usually see them back in about 2 weeks. I have found there are so many women who hear that breastfeeding is the best thing for them and their baby, who know that that's what they want to do, but then they aren't able to breastfeed or reach those goals because of pain or because of supply or because their baby's not gaining weight. And then because they don't know where else to go, they stop breastfeeding. And that can really leave a woman feeling really sad because she wasn't able to accomplish the feeding goals she had. So sometimes even with medical consultation, we still can't get her to those goals, but at least maybe she'll have a reason, and that can really make women feel better when they understand there's a medical reason behind it. Sometimes we have to kind of modify the goals a little bit. Maybe you can breastfeed for 6 months to a year, but it's with supplementation, and that's okay because baby's still getting some milk. Some moms talk about it like, you know, the baby still gets their vitamins and then they get their formula too. And there's lots of benefits to breastfeeding, even if it's some breastfeeding. So bonding, we know that any breastfeeding decreases the amount of SIDS, sudden infant death syndrome. So there's a lot of different ways to breastfeed. Sometimes breastfeeding looks like pumping and giving from a bottle. Sometimes breastfeeding looks like nursing just before baby goes to sleep and giving formula the rest of the time. And sometimes breastfeeding looks like nursing at the breast. So we want a woman to be able to accomplish her goals, and if there is a way that I can help her with that, then that's what I'm here for. Breastfeeding lactation consults with nurses, sometimes insurance is denying those claims. We know that women who have insurance through Anthem Cummins, those employees have gone to their HR representative and insurance representative, and Anthem now covers breastfeeding consults or lactation consults with a lactation consultant 100%. And that is something that women can do and employees can do. They can actually advocate for themselves that way and go to your HR and tell them, hey, we really need this service. We do know that breastfeeding saves an insurance company a lot of money, and so it is definitely worth it in the end to pay for some lactation help in the beginning. Seeing a breastfeeding medicine physician is almost always covered because we can use physician codes. I've never had it not covered. So that really shouldn't be a problem for access for women.
Nurse and Chat is a walk-in, kind of a drop-in environment that we set up about 6 years ago. And we're now located here at Mothering Essentials, 424 Washington Street. And moms can come in. It's very low key. It's just you come in when you can. It's between 9:30 and 11 every Tuesday. The moms can come in, they can ask questions about their baby, about weight gain, latch, or any kind of issues that they're having.
When I have a consult, it's just me and them for about 2 hours. We go through a full health history of mom and the baby, maybe their birth story, a weight check, and then I sit with a full feeding for her and her baby, and then make a care plan to help her meet any of their goals that they may have. A big thing with private lactation consultants is every time you call, you talk to me. So you don't have to go over your health history again or explain your whole story. I already know that. I'm able to follow up with you, and I follow up at least 2 times, and then anything that pops up in the future, I welcome moms to call me back.
On a regular basis, I see a lot of babies who maybe aren't gaining weight as fast as what's recommended, or they're having trouble with the latch. So with breastfeeding, the latch is important to make sure comfort for the mom and also that the baby's transferring milk.
A typical consultation with a mom is I come into her home. I also have an office that I'm able to use, so if she would prefer that. But I come in, we do a full health history with her and her baby. We talk about her birth story, we weigh her baby, and then I sit with her for a full feeding, and we're able to make a care plan to meet her needs and her breastfeeding goals. After that, I follow up with her over and over, and I'm able to refer her to other resources in the county to help her with her breastfeeding journey.
We started the Breastfeeding Coalition a little over 10 years ago. We found that in different communities throughout the state and really throughout the United States that there's not a support provided. So once you have a baby and you start nursing and you start your journey with your infant, that there's not support there. So we wanted to ensure that in Columbus, and we also help support the surrounding areas, Seymour, North Vernon, Shelbyville, and Greensburg, that there is support. So with Little HA League, those are all volunteers, very well-trained volunteers who have gone through a very rigorous process that they can provide support as well. They provide 24-hour phone help and also in-home visits, and that's all for free. So during community events, such as the Christmas parade or big events downtown on Washington Street, we have Mothering Essentials open for families to come up so they can have just some quiet time. They can use the restroom here. It's a nice clean restroom. They can have the space for their toddlers or infants to kind of play, stretch. They can also have a comfortable environment to nurse their babies.
All right, I have a special announcement to make today. For the Breastfeeding Coalition, we like to celebrate moms who have breastfed for the American Academy of Pediatrics 1 year. And we also have a special birthday girl with us today, Cora. So I wanted to present to you and Jenny your shirt. So congratulations and happy birthday.
My role here at Columbus Regional is I'm the nurse manager of our birthing center. That includes our labor and delivery, our postpartum, our lactation department here as well, and also our level 2 NICU. And then also I'm over our pediatric unit for the hospital as well. I think the biggest thing that makes Columbus Regional a great environment for a baby-friendly hospital is we have a focus in the hospital and the health system on innovation.
And Baby Friendly is a World Health Organization initiative, but it's also a very difficult one to achieve without putting that focus on how we put innovation into our nursing practice and also into healthcare practice as a whole. So I believe that that's probably one of the biggest things, and it really set the foundation for us to be able to achieve that. And we've achieved that designation from World Health Organization through a lot of teamwork with our staff, with our physicians, with our community partners. To be baby friendly is a really big deal, because out of the 96 delivering hospitals that we have in the state, currently 9 have that designation. Part of that is education for staff, that staff can provide the best, most up-to-date, evidence-based education to our patients, that they're providing them the right education and not just something that they heard along the lines. You know, there's all kinds of the old wives' tales that goes with childbirth and with breastfeeding, so that we're giving patients the correct information so that whatever feeding plan they have, that we can support it as best as possible. It is so important that Columbus Regional Health has that partnership with the Breastfeeding Coalition, because we have our patients here for such a short amount of time. And while I feel like we do our absolute best to give them the best possible start, it's usually 2 to 3 days. So we want them to have those resources out there in the community, and the Breastfeeding Coalition does such a great job, not only with the resources out in the community, but also setting our community up as a whole as a great place to provide care to our newborns and also to breastfeed in the community. The Nurse and Chat that they have is just an awesome resource that the Breastfeeding Coalition has, and we love to send our patients there because we know that they can have that follow-up, but they can also have those partnerships with moms that are going through similar things as them with breastfeeding. So it's just an all-around great thing for our hospital and also for the Breastfeeding Coalition.